Pie in the sky. All you need to know about female hair loss causes, prevention tips, hair loss products, baldness treatments, and finally natural products and treatments. Part 1: Female hair loss causes, hair loss tips for women. Is your hair thinning and falling out? Do you notice more strands of hair in your hairbrush after you get done brushing your hair in the morning? How about more hair in the tub or shower drain after every shower? These could be signs that you need to look into female hair loss causes. If some of the older women in your family have been victims of female pattern baldness, you may also be in line to suffer the same fate. If you know what the causes are, then maybe you can put some prevention tactics into action and decrease the predisposition to becoming bald like your mother and grandmother or aunts did. Some causes are due to medical reasons. The three main medical reasons are androgenic alopecia, telogen effluvium, and alopecia areata. Androgenic alopecia, or female pattern baldness, is the leading cause of hair loss in women. Androgenic alopecia can affect any woman at any point in her life, especially if she has a familial predisposition to hair loss. This means it is hereditary, and more likely than not you will experience hair loss just like mom and grandma. In androgenic alopecia, what happens is the hair follicles become very sensitive to the androgens in the bloodstream. Androgens enter the androgen receptors in the hair follicle and tell the hair follicles to produce less hair. Your hair then becomes thinner and soon the follicles die off and you are left with less hair. Telogen effluvium is the second of the most common female hair loss causes. This condition is caused by an increased amount of stress in your life. Unusually high amounts of prolonged stress causes your hair to become thin and fall out. You may notice this type of hair loss when you become pregnant. With all the changes your body goes through with being pregnant, all the hormone fluctuations can cause hair thinning or loss. Usually though, with the resolution of the prolonged, high stress, your hair will grow back just fine. Alopecia areata is the third most common cause of hair loss in women and may be linked to immunodeficiencies in the woman's body. If the immunodeficiency is identified, treated and gets resolved, then so does the hair loss and hair grows back. Other medical reasons a woman may lose her hair are vitamin and mineral deficiencies, including iron deficiency, which causes anemia. Thyroid dysfunction and liver problems can cause thinning hair. Chemotherapy treatments for cancer will make a woman lose her hair, but this is only temporary. When the course of chemotherapy is complete, your hair should grow back. Any of these conditions can be temporary, and when treated correctly and are under control, your hair can and will grow back. Menopause is also a big reason why some women lose their hair. Just like with pregnancy, menopause causes all sorts of hormonal fluctuations and hair becomes thin and fragile. If your hair loss becomes severe, talk to your doctor about female hair loss causes and ask to be tested for any of the above conditions to rule them out. You may just need to learn how to decrease the stress in your life to get your full head of hair back. Part 2: Female hair loss prevention. Stop the ponytail. Your grandma lost her hair, your mom started to lose her hair right around the age you are now, and you do not want it to happen to you. Luckily, you haven't seen any signs yet, and now you are seriously considering finding information about female hair loss prevention. Probably a smart move on your part, and if you are not seeing any signs yet, you may not be too late. If previous female family members have lost their hair, this condition is known as female pattern baldness. Let me caution you though, before you start spending all kinds of money on treatments you may not even need, ask your doctor to do some blood work to check for iron deficiency, anemia, electrolyte imbalances, thyroid dysfunction or iodine deficiency, or vitamin and mineral deficiencies. Any one of these can cause your hair to thin and fall out. Getting these seemingly small things checked, addressed and treated, if need be, at least yearly, can put your mind at ease and help you hang on to that full head of hair. Another female hair loss prevention idea is to minimize pulling your hair back into a ponytail. Go get a nice shorter style so you won't be basically what amounts to pulling your hair out by the root every time you pull out the ponytail holder, or at the very least making your hair break. Sounds like a simple thing to do, right? Sometimes the simplest things are the most effective in handling a problem. The way you treat your hair is important. Be gentle with it when you are in the shower, and when you shampoo, carefully massage your scalp with your fingertips and do not scrub hard. Scrubbing too hard can cause damage to your hair follicles and cause them to die. When a hair follicle dies, no hair can grow from it. Minimize damage by being gentle when you shampoo and use a good vitamin-enriched conditioner. The better conditioned your hair is, the less it will break and thin. Do not get me wrong, you do not need some conditioner that costs you a week's salary. There are good ones on the shelves of your favorite store that will do the trick and keep your hair shiny, full and manageable without a lot of breaking. Keeping your scalp healthy is important too. The vitamins found in your shampoo and conditioner will help in this area too. A healthy scalp means healthy hair follicles, and healthy hair follicles mean a healthy, full head of hair. Some say that a good dandruff shampoo can help keep your scalp healthy too. So if you noticed your scalp is itching and you start to see some dandruff, or even if you don't see any, use some dandruff shampoo to keep your scalp healthy. Use these tips and ideas to help you with your female hair loss prevention and to minimize your hair loss from female pattern baldness. You can maintain your beautiful, healthy hair for a long time to come. Part 3: Female Hair Loss Products, Female Pattern Baldness Treatments. Talk to your physician about your hair loss and the possibility of using female hair loss products to reduce the number of hairs you lose in a day or even regrow some hair. Not that you can accurately count the hairs you lose every day, but if you estimate that you are losing at least 100 hairs a day, you may want to speak with your doctor. Hair loss is not, nor has it ever been, strictly a guy thing. Believe it or not, 40% of women develop hair loss by the time they turn 40. The fact that self-image and emotional well-being is important to most women, hair loss can be the most devastating thing that can possibly happen to them. Called androgenic alopecia, or female pattern baldness, there used to be very little that could be done for hair loss in women short of wearing a wig every day. Now there are products available for women as well as men that will stop the hair loss and may even regrow some hair. Some female hair loss products that you may have heard of include Rogaine, or minoxidil. You can buy Rogaine over the counter and it is rubbed into the scalp twice a day. If your hair loss is caused by your immune system attacking your hair follicles, a condition called alopecia areata, medications like corticosteroids are injected into the scalp multiple times, about 1 centimeter apart, every 4 to 6 weeks. This is the most common treatment for this condition. Corticosteroids can also be used topically, for which get rubbed into the scalp. These corticosteroids creams are of little effectiveness when they are used alone and are usually used along with the injected steroids or the minoxidil. Other not widely used therapies for hair loss in women are oral corticosteroid use and contact immunotherapy. Contact immunotherapy is considered the most effective treatment for severe alopecia areata. The medication used is painted on the scalp every week, and every week the strength of the medication used is increased, but the medication irritates the skin, leaving it very itchy and scaly. Losing your hair is bad enough, but if your scalp looks like someone sprayed your head with napalm, then it is even more so. Oral corticosteroids are rarely used due to the adverse side effects of oral corticosteroid treatment. If they are used, however, hair growth usually occurs with treatment. A safer and less irritating therapy is called PUVA, or psoralen with ultraviolet light therapy. A medication, called a psoralen, is applied to the scalp, making the skin of the scalp more sensitive to UV light. Then the skin is exposed to UV light. Something you should know and remember about treating hair loss that is inherited: the medication you are taking will not give you back a full head of hair. Hair will regrow on the top of your head but will not grow on your forehead. You will also have to continue taking the medication long term, because if you stop taking the medication, your hair loss will start again. All of the female hair loss products outlined above are effective in helping regrow hair. Part 4: Female Hair Loss Product, Natural Treatments Prevail. You begin your search for a female hair loss product and are soon inundated with the seemingly endless number of products who state that they are the best, and now you just do not know which way to turn. My advice to you is back up, sit down and take a few deep breaths. This is really not that hard of a decision. What you are looking for is something that will help your hair get thicker and maybe even grow more hair. The decision you need to make right now is, do you want to go the all-natural route, or do you want to put a lot of chemicals onto your hair or into your system that you are unsure of? If it were me, I would choose an all-natural female hair loss product and forget about harsh chemicals that may make my condition worse or cause an allergic reaction. Chemicals strip your hair of their natural oils and weaken the protein, called keratin, and cause more breakage and thinning of your hair, only making a bad situation worse. Your best bet to combat the thinning hair and/or hair loss are the all-natural products that are gentle and do not contain harsh chemicals. Products containing saw palmetto, vitamins A and C, rosemary and green tea are the best things to use. Use them in combination with each other or by themselves. They are all effective in strengthening the hair follicles and hair strands and keeping the scalp healthy, too. Just make sure you find out how to use them correctly or they won't work as well for you. For example, the green tea should be applied directly to the scalp, allowed to air dry and left on overnight several times a week in order to be most effective. Shampoos that contain the herb saw palmetto should also be combined with biotin to strengthen your hair strands and stimulate the hair follicles to continue growing hair. Do not use any shampoos that contain any form of alcohol or a chemical called sodium lauryl sulfate. Both of these will weaken your hair and lead to thinning and breakage. Sodium lauryl sulfate is an industrial-strength degreaser and is in most of the things you use on a daily basis, from your shampoo to liquid dish soap to even your toothpaste. It is basically poison to the human body and can cause you to have headaches or seemingly unexplained muscle soreness. Most people condition their hair after shampooing, therefore you need to make the same decision about the conditioner you use that you made about the shampoo you use. The conditioner you choose should have all the vitamins and minerals your hair needs to be healthy and strong. Natural oils like olive oil and coconut oil are great for conditioning your hair. You can even make your own conditioner by combining mayonnaise and beer and applying it to your hair for a deep conditioning female hair loss product effect if your hair is particularly dry or damaged. Do not forget to subscribe to the Eye in the Sky channel and press on the bell icon. Thank you for watching.